Hello, everyone. So now we are going to have something that I think is very important to all of us, a mental health wellbeing partnership. And this is presented by Matt Boltz-Johnson from EURODIS. And a little background on Matt. He joined EURODIS as a healthcare researcher and director in 2014 and has now become the mental health lead advisor. And he is the lead advocacy for rare disease community by developing and delivering a European research national. And as is important to all of us, it's patient-centered as always. So thank you very much, Matt, and let's take it away.
Thanks a lot. Thanks for inviting me. I was asked by class to give an update on the work we were doing on mental health at EURODIS, collaborating with our community. 2 years ago, this is a picture taken at our EMM, our membership meeting, which is coming up actually this month. So it's been 2 years, and where we launched the Mental Health Partnership Network. We have now actually over 140 people involved. About 70 of them are clinicians, researchers, and psychologists, which is great. We're connecting to about 19 of the ERNs, and we've got some great patient leaders, community leaders. These are some of the activities I'm going to talk about in more detail, from advocacy, communication campaign, survey, which we're about to launch, and a toolkit. We've updated our website, so we have now a dedicated page on mental health and well-being, and one of the key things of that was to really put up front what the impact of rare conditions is on mental health. So we called it Putting the Face to Rare Conditions, and we've had a call for people to share their testimonies. I must confess this was inspired by actually working with Klaas, because he did one with Mental Health Europe on neurofibromatosis type 2, and so we've actually got 3 of the 3 stories or testimonies given, one on chondroplasia, one on congenital malformations, and the other one on a rare kidney condition. And we've just published one on living with a syndrome without a name. So we're really open to, if anyone in your community wants to share their story, their experiences, and we would also add this to the website. But we started this media campaign to really put a face to the impact of rare conditions on mental health, because it's otherwise it's quite abstract. We did last year 8 webinars, which you can see down here. They're available on our website. The last 3 were really great: how to communicate diagnoses, how rare conditions have shaped self-identity, and also family relationships overall. This year we're going to do a webinar on breaking down stigma, coping strategies, and building resilience, and another one about care. How do we safeguard the caregivers? The webinar on how to deliver a diagnosis, we got some really good input on best practice and what clinicians really were doing, and so we've collected them and we put it in this guide, which is now available on our website. I was invited to Nijmegen, which is a medical center in the Netherlands, and I actually spoke to the trainee geneticists about the impact of rare conditions on mental health, and we talked a lot about how to deliver a diagnosis, because I don't believe it's really covered in medical training, and whilst there is no good way to deliver difficult news, actually time isn't a barrier for having good communication and not transferring the uncertainty with the diagnosis, but taking responsibility of that. So we've got some really good helpful hints here. We worked very closely as well with Klaas on developing a position paper, and that position paper is now published. It was to take what the UN resolution had highlighted, that member states should develop psychosocial care programs for people living with rare conditions. That was a UN commitment. So the position paper reiterated that, but we went one step further and we tried to say, well, what does that look like? What does psychosocial care look like for rare diseases? We know what it looks like in pediatric oncology. There's some great literature out there and clinical protocols, etc. And psychosocial care is embedded in pediatric oncology. But when it comes to rare diseases, it's not. Family groups step in and fill that gap and provide support to hospitals to put these things in place. But so we outlined and we scoped out with the community what the model looks like. And the key bit really was for pediatric oncology, psychosocial care starts at diagnoses. For rare conditions, it should start at suspected a rare condition, because we know that when people are supported through the undiagnosed pathway, they get a diagnosis 1 year earlier. We also learnt from our community. Last year, we started a co-creation process to develop a mental health toolkit. Over the past 12 months, we've scoped that out, what that looks like, and it's just about to be published on our website. This is the sort of screenshots from the new web page. It's structured to cover how to support yourself and build esteem, to adapt to a condition, to manage daily life. It covers the whole rare disease journey, and it provides tools and guidance, empowerment tools, and you can see here we've got 5 sections: self awareness, rare resilience, practical tools, caring connections, and sort of meaningful management. Most of those they all have a brief description, but we've identified good practice tools out there and we made them available. We're going to update this on a periodical basis. As I said, our EMM, this was 2023. In this year, which is coming up 22nd of May, we are doing a peer support, peer training, capacity building workshop jointly with Rare Minds, and we're focusing on using the toolkit and how to build community resilience, but also how to support and help advocates and leaders not to burn out and to get a good life balance. We have at the beginning of this year, EURODIS are taking part in the ERDIC Stigma Task Force. ERDIC is a research initiative globally, and this has been 2 years in the making, but we're really excited about looking at how really developing not just understand the evidence around stigma, but key things to how we can tackle stigma. So it was just launched actually last month. So that's a really new initiative which we're actively involved in. I mentioned about a survey. We have a tool called Rare Barometer Survey. We have about 15,000 people from lots of different countries around the world signed up to this survey platform, and they say that they will complete the survey. The survey we're doing this time is on mental health and well-being. It will be launched between June and September this year. It will be available in 25 languages. It's available for people for all rare conditions, and the results will be available in December. I invite you, the neurofibromatosis community, to hijack this survey. Your community in all the different countries can complete it. We will give you disease-specific results and country-specific results, which you can use in your advocacy. We have been working at developing the literature. We had in 2022, just before we launched the network, did a publication on the importance of psychosocial support for parents and caregivers at diagnoses. We have just finished and we submitted to the same journal actually last week 2 publications on psychological support after diagnoses. So the first one is looking at how to live well with a rare condition, what are the key needs? And the second paper is really focusing on psychological support. We plan this year to finish off this set. So we've got at diagnosis, after diagnosis, i.e. living with the condition, but we're going to do a review before diagnosis on the undiagnosed pathway. So that's planned to do this year. So just some headlines of the results. Just 3 slides. I won't go into huge detail because of time, but we need to start raising the importance of quality of life. You know, what we find is physical aspects of a condition have a profound impact on quality of life, but actually the feelings, beliefs, and our expectations magnify the impact on quality of life. So, and those beliefs, feelings, and expectations are shaped by the interactions we have with doctors, with medical teams, with people in the community. So how someone talks about, for example, neurofibromatosis type 1 at diagnosis and thereafter almost colours the person's view of that condition. So if the language is one which is a bit negative, which a lot of the time it can be, it can really increase the distress and impact quality of life in a bigger way. So language is really key, and how we talk about it and how we can support people to be empowered to rise up to the challenge the rare condition brings. We know that whilst we feel that our physical healthcare is looked after in a specialist centre when we get there, actually it's up to 85% of people there. The HCPs have never asked them about their emotional or psychological well-being, and you know the impact of a rare condition is profound. It changes our role in society. It changes our relationships and our abilities to work or our career aspirations. We experience a disruptive normality with an overwhelming need to know because of the uncertainties around a lot of conditions. There's no one average person living with NF1. Everyone has a unique pathway, and so information should be tailored specific to the individual's needs. And that gap in knowledge creates a bit of a double-edged sword, that we search for all information and we have a high thirst of knowledge. But with that, we can then actually create more uncertainties because potentially there's more things which can happen, and we end up reconstructing a new normality. The key themes are, I've just talked about control and uncertainty, impact on self-esteem, body image. Stigma is key, not just structural, i.e. issues with accessibility and adaptation in our community, in our society, which prevents us from accessing stuff, but also how other perceive appearance, and also the lack of understanding of an invisible condition. With stigma, it can be that we end up always having to explain away the condition which we've got, whether it's visible or invisible in terms of difference, and that can make people feel more isolated because they think it's not worth it in the end. We talked about fragmented care a bit earlier. Fragmented care magnifies the challenges families face. Medical care is medically focused, and so guidelines, there is a lack of being more inclusive and covering psychological health aspects. They really are biomedical focused. And the last slide, we know that family functioning is the most important predictor for quality of life and mental health. I think when you strip back mental health, it really comes down to relationships. do you have good relationships at work? Do you have good relationships in the community? Do you have good relationships in your family? If you have good relationships, if you're fortunate to have that, actually your mental health and well-being will be good. But as soon as you start to have challenges in those relationships, it can really impact on quality of life. One thing which we know, just to finish off, about partners, parents, or the main caregivers, a lot of the time people don't want to, all the time when they go to let's say a hospital appointment, is focused on the person living with a rare condition. Especially parents don't like any feeling like they're taking any of that time, because they feel like they're stealing that from their child, and they want all the resources on the child to sort out and give the best advice. But parents, partners and caregivers are the main support for the person living with a rare condition. And when their mental health and well-being, their quality of life is poor, then that has a direct impact on the individual living with a rare condition. So my take-home message really is, if you're a parent or a spouse or a partner, think about what you can do to look after your mental health well-being, because that has a direct positive impact on the support you can give to the person with a rare condition. Lastly, siblings are really have unique needs. They can feel that they have unrecognized psychosocial issues, feeling of it being invisible, isolated, and lack of support. They experience worry and despair while trying to contain their own feelings, so not add to what could be pressure in the family because of the physical health condition. So they really try and make sure that they don't add to that. But they're keen, and they become a real sort of they become really knowledgeable on daily life and self-care of the condition. So they should be prioritized. That's it. Don't know whether I went over. I tried my best.
Thank you very much, Matt.